Are you patient, tolerant, and non-judgmental? Are you empathetic to those struggling with mental wellness or substance abuse? Are you able to remain calm in stressful situations? Then you may be well suited to a career as a mental health aide. Mental health aides are healthcare workers who help meet the care needs of people with mental wellness issues. These issues can include mental illness, addiction, developmental delays, cognitive impairments, or brain injury. We spoke to a mental health aide in Alberta to get more details about this important career.
Hi, my name is Lexi and I'm a mental health aide. As a mental health aide, I am a healthcare worker that helps care for many individuals with mental health challenges.
Okay.
A mental health aide could work in a variety of places. They could work in community, they can work in an acute unit, rehabilitation unit, can be in a brain injury unit, you can be in more of a geriatric unit. Personally, I work on an adult psychiatry unit that's longer term care. A typical day on my unit, I come in, we have reports, so the nurse gives report from the previous shift. Some people might have more care than others, so you might be using lifts during the day or like toileting someone. Or some people, you might just have to give them cues, just remind them, hey, it's time to get up and it's time for breakfast, time for lunch, like those kind of things. You might need to shower them, cue them in the shower, or you might have to do like changing them, feeding them. If you're in the kitchen, you're preparing meals. After that, you kind of go through and see if you can assist with laundry. Throughout the day, there's also rec groups, so you'll be telling the patients what time those rec groups are and encouraging them to go as well. Some of our other responsibilities as mental health aides is taking people to appointments. So whether that's in hospital, they might need x-rays or lab work. You might be going to another facility, whether they need dental appointments, hearing aid appointments, anything like that. You might have a little bit of spare time. You can play cards with the patients, take them for walks. Part of your job is creating care plans with the nursing team, so you can make suggestions to the nurses in creating those care plans, whether it has to do with like their hygiene tasks or just to assist with like their daily living cares. We kind of just finish off the day with kind of hanging out with the patients, just keeping them busy, and also just maintaining rounds. My hours of work can vary. I work shift work, so I could be days, evenings, nights. I might be working weekends. Some people just have a Monday to Friday day shift. It really depends what kind of facility you're working at. Some of the skills and characteristics needed for this job are definitely patience and caring and empathy. This job can be stressful. You are dealing with patients at their lowest. Being able to deal with that is a very important part of the job. Communication skills are also really important, and problem solving as well. You might find yourself in a stressful situation. You need to remain calm and allow others to help as well. You are on your feet for quite a bit of the day. You're walking to and from units. Maybe you're transferring patients to different appointments. During some of the patient care, you are required to use lifts when you're transferring patients to and from bed. We're using gloves every day when we're delivering like personal care, also dealing with like bodily fluids. In some other situations, you might be fully gowned, gloved, masks, anything to keep yourself safe. Education requirements vary depending on your employer. Many post-secondary schools in Alberta offer programs, and the program length varies. I myself didn't go to school. I got all my training on the job. I did nonviolent crisis intervention. I went through my mental health first aid. Another course that we had to take was our basic life support course, and that needs to be renewed every year. I became a mental health aide because it's so rewarding seeing the progression in patients. Like, you might have someone that comes in at their lowest, and the care you deliver helps them to be able to discharge back into the community. There may be challenges that you deal with, but in the end, it is very rewarding.
To succeed as a mental health aide, you must have good communication, critical thinking, and problem-solving skills. Empathy, emotional maturity, and good judgment are also essential. If this sounds like you, why not think about a career as a mental health aide? Find out more about this occupation, including training requirements and salary ranges, in the occupational profile on the ALICE website. While you're there, check out some related occupations, including healthcare aide or mental health worker. Explore the possibilities. Go to alice.alberta.ca.